Hi, I'm Ruth O'Regan, Chair of Medicine at the University of Rochester. So the standard of care in patients who achieve a pathologic complete response to chemotherapy would be to receive radiation, certainly, of course, if they had breast conserving surgery. I think where the controversy comes in is in patients who have had preoperative chemotherapy, have a pathologic complete response, and have had a mastectomy. So one of the questions there is, do those patients really need post-mastectomy radiation? And there is an ongoing trial, or at least one ongoing trial, looking at randomizing patients to chemotherapy or not in this setting. The standard of care currently, I think, would be to consider post-mastectomy radiation in patients who have had a positive lymph node prior to starting chemotherapy. In patients with node-negative breast cancer, I think if they have a mastectomy and they have clear nodes, it's obviously very reasonable not to give those patients radiation. Obviously, another question, of course, however, is in patients who achieve a pathologic complete response and had breast conserving surgery, would you consider not doing radiation on those patients? And I think at the moment, based on the data that we have, I think the standard of care continues to be radiation. So I think this is an opportunity for de-escalating therapy with regard to radiation, because we know that patients who have a pathologic complete response, particularly if they've got estrogen receptor negative breast cancers, have a very favorable outcome. But I guess we don't know at this time point whether you could omit radiation and achieve local control in those patients. So I think these trials are very important. So hopefully down the line, we will have some patients where we can avoid radiation when they have a pathologic complete response to preoperative chemotherapy.